Can everyone see my screen? What they are seeing right now? Can you see the PowerPoint presentation? Okay, awesome. Thank you. All right, so let's get started. My name is Stella, and thank you for joining me today for this orthodontic shadowing session. I am a newly graduated orthodontist, so I just graduated in December 2 weeks ago. And So this is today's agenda. I'm going to start by talking about my journey to orthodontics. And I was asked to give you guys some advice on getting into orthodontics residency. And then I'm going to talk about a typical day in ortho residency, as well as my own private practice, Stella Orthodontics, and my first 2 days at work during the last 2 weeks. And lastly, we'll finish by talking about ortho diagnosis and treatment planning, and I'll share some cases with you guys. So I was born and raised in China, and I came to the US as a foreign exchange student. So during the senior year in high school, I went to a high school in Michigan. Following that, I went to Pasadena City College, which is a community college. I was there for 2 years, transferred to UC San Diego. For those of you guys who are looking to transfer or getting into college, I don't know what kind of age group which stage are you at right now? But UC San Diego has a pretty great pre-dental society. They have the entirely student-run free dental clinics that designed to serve underserved population in the San Diego area. So I highly recommend UC San Diego and their pre-dental society. After that, I went to dental school at UCLA and got my orthodontic certificate at University of Nebraska Medical Center. And during that time in residency, I started my own private practice, Stella Orthodontics, which is currently in construction. And some advice on getting into ortho residency: first, get into dental school first. And once you get into dental school, by exposing yourself to different dental specialties, you'll have a better idea whether you want to do general dentistry or specialize in something else, such as orthodontics. And as in getting into dental school, in addition to getting decent grades, I recommend joining some extracurricular activities, such as joining some organizations, taking on some leadership roles, and of course, do some shadowing and externships. What are you guys doing here by joining this virtual shadowing session is great. Other things include community service, teaching, mentoring, and getting involved in organized dentistry. I guess that's something you do after you get into dental school by joining events and conferences, ADA, like American Dental Association events, and ASTA, which is a student organization under the ADA. And if you have some other creative interests, like if you play a sports or instrument, that's great too. More specific, for getting into ortho, I recommend getting involved with research. In orthodontics, a lot of critical thinking is required. So a lot of programs want to see some degree of research experience. If you don't have any, that's fine too. It's absolutely not a requirement. And for dental school, you have to take DAT. And for ortho, you take ADAT and GRE. It's also not a requirement. It depends on the program you are applying for. Some requires it, some require those 2 exams, some just recommend them. And lastly, getting some letters of recommendation. So it's great to build some relationships early on, and so when the time comes, you can ask for some letters of rec. And lastly, work hard, but take care of yourself. Our body is our foundation. Get enough sleep, drink enough water, meal prep, all those things. As hard as you want to work, but make sure you also take care of yourself. And next, I'm going to talk about ortho residency. Also, anytime if you have questions, feel free to chime in and just ask in the chat box. And thank you so much. Thank you. Feel free to reach out to me as well by messaging me. Anytime you have questions, reach out to me or interrupt me or ask at the end, either way. So ortho residency is typically 2 to 3 years. Some are university-based, some are hospital-based, and some are private schools. And some offer master's degree in addition to an orthodontic degree, and some don't. And mostly ortho residency are paid residency, so you have to pay tuition to do your ortho classes and your master's classes. However, there are a few programs in this country that does pay you a stipend or pay you a salary. Typically, they are hospital-based program. And typically, ortho residency have 2 to 6 people per class. The Mayo Clinic only have 1 person per class. Our program has 3 people per class, and some larger program have 14 or even 30 people per class. But typically, I'll say 4 to 6 is a good number. And the residency I went to is University of Nebraska Medical Center. So even though it's a medical center, we're not really based in hospital. They have a dental school, so the ortho clinic is within the dental school. And we do get paid some stipends, not much, but it helps. A typical day in ortho residency, the program I attended is 30 months, so 2.5 years. And this is my actual calendar, Google Calendar over here. I try to delete some patient last name. So, but basically, this is my actual calendar. What's shown in green are classes, and what's shown in blue are clinics. And in addition to clinics, we have some free hours where you can treatment plan, diagnose, do whatever you need to do. So first year, you have a lot more didactic classes than other years. And you start clinics, basically treatment planning, taking records including photos, x-rays, things like that. And since our program offers a master degree, so you have to select your research topics and advisors. And second year, greens are classes, blues are clinic, and blues are like webinars. So we have less classes, slightly more clinic sessions, and during the second year, it's a year where you focus on your research to get your research mostly developed and written down. And during the second year, you have to take the written board exam. So to be a board certified, to be an orthodontist, you have to pass a board during ortho residency and graduate as a second step. Then you become an orthodontist. But to become a board certified orthodontics, you have to take a clinical board after graduation. So in my case, I took the written board as a second-year resident, graduated 2 weeks ago, and I'm taking my clinical board in February to become a board-certified orthodontist. Can you practice orthodontics without being board certified? Absolutely, because you graduated from an ortho program. But it's an extra step to become board certified. This is my third year schedule. Mostly as a third year, you just see patients in clinic all the time and finish up your research. So mostly clinics, minimum didactics, but case conference is where we discuss different cases, and current literature review is your review journals, peer review papers. And minimum classes, more clinics, and you finish your research and defend thesis and prepare a clinical board and apply for jobs, and basically getting all the work done to prepare for graduation. So since our program is more like a paid program, so our schedule is very structured from 8 to 5. You don't see anything before 8 and after 5 or during lunchtime. So whatever your interest is, whether that's working out or trying to learn something about business or practicing instruments, you can absolutely do those during those hours. Those are just some pictures from ortho residency. I personally go to a lot of conferences because I just love meeting people, learning new things, and learning about what's on the market, like instruments or like ortho instruments or like equipment. So this is at AAO, American Orthodontic Advocacy Conference. And this is at University of Michigan, where all the residents come together and hang out and learn at lectures. And yeah, those are from conferences. And this is our clinic. This is, we dressed up in onesies for Halloween this year. And since I went to Nebraska, people are crazy about the Husker games. Those are me and my husband, Mark, at the games. And in Nebraska, fall is a big season. So apple picking, pumpkin, going to pumpkin patches is always good. And when this is my Hawaii trip, and also I learned how to make mixed drinks. In addition to that, so you absolutely have time to do other things as well. I took a mini golf class. Still don't know how to play golf well, but that's something to that I did outside of school. And defended my thesis in November last year, just about 2 weeks ago, and graduated 2 weeks ago, December 16th. And after graduation, I moved directly to Arizona. So I'm physically in Arizona right now, and my own orthodontic practice, Stella Orthodontics, is in Arizona. Next, I'm going to talk a little bit about my journey to start my own orthodontic practice. It's a big topic. If you guys want to, I'm happy to do another session on this topic. Basically, to get started, the first person you need to talk to is a bank. And for every person you need to hire or you need to work with, I recommend a rule of 3, basically for every person you work with. Interview more people. Interview 3 to 5 people and pick the one you like or you like the best or work with your situation the best. But the first person you need to talk to is a bank. You need to get money unless you have, for startup practice, orthodontic practice, the average loan amount is, depends on the situation and the location too, is $600,000 to and up. So unless you have those money, you need to talk to a bank. And then there are some consultants you can hire, attorney, CPA, architect, engineers, IT vendors, equipment vendors, of course, marketing and website vendor. And there are more people you need to talk to build something from scratch. I'm sure this is something similar to general dental practice too, if that's what you want to do. If you want to become a practice owner, in addition to starting your own practice, another way is to buy an existing practice, which is something I also explored. It's just that there are not many options. There's just not a lot of orthodontics on the market for me to buy, so I decided to start my own. This is a building. It's in a medical building. I live right now walking distance to the practice. It's a brand new building. It's a medical building. So in addition to my practice, there's a general dental practice, pediatric dental practice, some physical therapy office. This building you see right here is located in a large shopping plaza where they have many restaurants and fitness centers and dessert places. And I am right here at this corner on the 3rd floor, and this is how it looks inside. Basically, this is my space. It still looks like this. We're starting construction now, but there's not much in there yet. But basically, this is a space. This is a shopping plaza and an apartments. This area is now empty, but I think it's going to get developed. Shopping centers or homes or apartments later. And this is a 3D rendering of how my practice will look like. This is the waiting area, front desk. And on the left, you see 2 consultation rooms. Basically, the new patient will come in, you'll do an examination, present your diagnosis and treatment plan and financial options. Walking down the hallway, orthodontic office typically have an open bay layout. On the left, there are 6 dental chairs. On the right, there are 2 chairs. This is a central island area where you'll get your trays and stuff you need for the patient. And that's my office. Here is the lab area, staff lounge, and brushing station. This is a sterilization center and a 3D printing area. Yeah, that is my office. It's being built right now, so this is just a 3D rendering. And since graduation, I worked 2 days at Pacific Dental offices. Pacific Dental is a DSO, dental service organization, and they have some of their offices have orthodontic open bay. So this is my part of the area at one of their offices. They have 5 open bay orthodontic chairs. On my first day, I had 4 columns, 4 assistant, and saw 40 patients. And second day, similar, 4 columns, 4 assistant, and 45 patients. Compared to residency, where you see maybe 10 patients a day max, 45 patients, actually it doesn't seem, it's not a sudden change because you get so many assistants. In residency, we get assistant who will help us break down, turn over the chairs, bringing in, setting up the chairs, bringing everything and suctioning, helping chair side. However, at in real life private practice or at ortho offices, you get assistant who do a lot of work for you. In residency, I do everything with assistant helping me with suctioning and handling instruments. But over here, assistant, especially orthodontic assistant, they untie the colored rings, they take out the wires, they put back the wires, they do a lot of things. All orthodontics do is like tell them what the next steps are. Like you make the wire bending, you put braces on, you take braces off. Basically, any invasive procedure that requires a handpiece also requires an orthodontic physically doing the work. So even though it's a big jump in patient volume, I didn't think it's too. I didn't think it was too busy or too hard to handle. So, and next section, I'm going to talk about ortho diagnosis and treatment planning. So diagnosis starts from collecting patient data. You get your patient data from your patient interview. Typically, you ask their age, their developmental status, like how old are they, and you do your intraoral, extraoral examination, and you can also do skeletal analysis from X-rays. So basically, you gather all the data available to form your diagnosis, which is your problem list. So from the initial exam, you get a chief complaint, medical history, dental history, do your examination, and you take records. So orthodontic records typically include photos. Sometimes people still take a task, like you take an alternate impression and pour off the models, but nowadays a lot of people just take a digital scan, which is a digital impression. And you also take X-rays, lateral cephalograms is a common one, and panoramic X-rays also. Nowadays, more and more people also take CBCT scans. So you gather your patient data and you do your analysis, and you form not only a problem list, you form a prioritized problem list. For example, if you have a lot of crowding, that's your #1 priority, and the patient is concerned about the crowding, that will be your #1 priority on the list of your problems. And based on your problem list, you want to form treatment objectives. Go back to our crowding example, your treatment objective in this case is to decrowd or align upper and lower teeth. And based on your treatment objectives, which are your end goal, you form your treatment plan. So you know where you start the data from the data gathering, you know where you want to go. That's your treatment objectives. And the middle part is a treatment plan part, which I think is really fun. It's like puzzling. You know the beginning, you know the end, but you need to plan how you're gonna get there. And different orthodontics are gonna have different treatment plans, which is totally normal, and each person do their things their way. Which is why a lot of orthodontic programs don't teach residents one treatment philosophy, which is, I think it's great. And then you'll perform your treatment, and retention is also important to make sure your treatment results stay stable. So we analyze orthodontic problems from dimensions. You have your alignment, you have your AP dimension, which is anterior, posterior, basically from the front to the back. You want to also analyze vertical dimension, top to bottom. Transverse dimension is from left to right. How wide is upper and lower arch? Lastly, alignment is, do we have spacing or crowding? Alignment, again, dental crowding, spacing are some common examples. Crowding is something you hear most often why people want orthodontic treatment. From front to back, AP, anterior posterior dimension, we have normal class 1, where this mesial buccal cusp of upper first molar touches the mesial buccal groove of the lower first molar. This is the dental classification. We also have skeletal classification. Basically, just means upper and lower teeth from the front, back, anterior, posterior perspective, they're aligned, they fit well. And class 2 is where you have a large overjet. So basically, upper teeth are forward compared to the lower teeth. So your upper jaw skeletally is positioned forward compared to your lower jaw. Class 3 is the opposite. Class 3 is dental-wise is underbite or skeletally. The lower jaw is just forward positioned compared to the upper jaw. The vertical dimension is dentally, you have open bite and deep bite. When you see those kind of presentations, it can either be dental, meaning teeth position, or skeletal, meaning their jaw position, in which case, in a growing child, if you have skeletal problem, you can do intervention to help correct skeletal discrepancies. In adult, however, surgery is the only option to correct jaw positioning. Transverse dimension, which is how wide from left to right. Left to right, midline is an example, transverse dimension. Brody bite, you see on the left is basically upper posterior teeth, back teeth are outside compared to the lower teeth, and opposite can happen where the upper teeth are too narrow, so they are positioned inside the lower teeth, and yes, as shown in this picture here. And this is a summary of what we just talked about. 3-dimensioned AP, vertical and transverse, and you have your alignment too. In addition to this, you also we're treating patients, not only their teeth, but also patient face. You want to achieve a straight teeth, yes, but also a beautiful smile that's harmonious with their facial proportions or their facial features. So soft tissue analysis is something we also add to our problem list and treatment objectives. Basically, soft tissue analysis look at their nose, lip, chin relationship, in addition to many other things. So common orthodontic treatment modalities, as we all know, we have braces and aligners, and braces nowadays have metal and ceramic. Twin brackets are something that you have to put a colored O-tie on top of the wire. Self-ligating is the one with a door. So instead of using colored tie, you open and close a little door on top of the wire, so the wire stay in the bracket. We have buccal braces, basically the braces you commonly think of when you think of braces, and lingual braces is also commonly known as hidden braces. The braces goes on the to the tongue side, so people won't see that the patient have braces. And then stock braces is what we typically use, but now we have custom braces options. What they are is that you scan the patient teeth and braces are printed specifically customized to the shape and contour of the tooth. So basically the entire treatment plan is customized and digitalized at the beginning. That's another option. With aligners, commonly we know Invisalign, there are some other aligner companies, and you can either get aligners from a manufacturer, like Invisalign, they send you aligners, or you can print in-house with your 3D printers. Not only you, most of the time we print models and make aligners on top of it, but right now there's a company that make direct printing aligners. So if you want to, direct printing aligner is another option. The technology in this area is developing very fast, so many exciting options are available. So metal braces, clear braces, stock or custom Invisalign aligners, you can either buy from manufacturers, Invisalign and some other companies, or you make your in-house aligner. Embrace is a company that does lingual, and other companies include Incognito and some others too. In addition to braces and aligners, in a growing patient, such as a teenager, if they have skeletal discrepancy, meaning their jaw position isn't ideal, we have some appliances that can help correct the growth of the patient. Headgear, for some examples include headgear, face mask. Those are expanders. Expanders basically serve to loosen up the suture, so the tooth, so the maxillary teeth can become, basically you separate the suture, so the upper teeth become a little wider. So those are some common appliances to bring mandible forward, or to encourage mandibular growth for class 2 patients. Class 2 patient, as a reminder, is where upper teeth or upper jaw is positioned more forward compared to the lower teeth or lower jaw. And they can either be fixed, meaning they're glued, fixed onto the teeth, or removable, meaning patient can take them in and out. So those are some commonly used appliances. And extractions are always an option. So basically, when making an extraction or non-extraction plans, you want to ask, is there enough space in the dental arch to accommodate all the teeth in ideal alignment? If not, you must create space by either extractions, or if you want to do non-extraction, there are some other ways to make space. However, extraction provide you most space. And Dr. Profit wrote a textbook that's required. That's a required reading in most ortho residencies. And this is his guideline. If you have a lot of crowding, such as 10 millimeters crowding, extraction is almost always required. If you have moderate crowding, 5 to 9 millimeters, maybe not. The case is on a borderline. Sometimes you can do a therapeutic diagnosis, meaning you start with non-extraction, try to fit all the teeth together, align them, and in a few months in, you reevaluate to see if extraction is needed. And that's for the borderline cases. Or if you have minimum crowding, you can use other methods to create space instead of using extraction. So extraction in this case is rarely indicated. And when orthodontics move teeth, so braces and aligners move teeth. But if you have jaw discrepancy, meaning your jaw is positioned too forward and too far back, surgery is always an option, especially in adult population where growth modification is not an option. In addition to all the appliances, we have rubber bands or TADs, that's temporary anchorage devices. It's basically like a mini implant. You screw in the bone and you hook elastic and different appliances to help move teeth. This is a video I made on different rubber bands patterns. Basically, this is a large overjet, but commonly known as overbite. You use class 2 elastics, underbite. In class 3 cases, you use class 3 elastic. There are many other elastic patterns. And next, I'm going to share some cases. So this patient is a patient of mine at all the patients are in ortho residence, are patients of mine in ortho residency. Basically, she has crowding and some teeth that's ectopic. And she had a car accident prior to when she was younger. So this is what you see is from the car accident. So this is a lateral self X-ray, pan X-ray, and this is a composite or collage. You take photos to make an orthodontic composite. And this is our treatment progress. Basically, our treatment plan is to take out 4 teeth, 4 premolars. So the teeth without braces here are the teeth that get taken out, will get taken out. So we put braces on, leveled and aligned teeth. And when she's ready for extraction, 4 teeth are removed. And after teeth removal, we basically tried to close all the space, upper and lower space. And another progress photo where spaces are mostly closed. And this is her finish. And to close space, you can see there are power chains used. Basically, it's a rubber chain that's get hooked on all the teeth to help close space via the elastic or the force from the power chain. So this is her finish. And when you take all the records at the beginning of treatment and you take the finishing records at the end of treatment, ideally, all the jewelry should be removed when you take those x-rays. However, she had trouble removing them, so we see her earrings on the x-ray. And another case, a 13-year-old teenage boy, he had a we call it classic presentation for class 2 presentation with some ectopic canines. His chief complaint is, I don't like my vampire teeth, which I thought is really cute. And so basically we don't have a lot of space for those canines. However, we created space using the open coil spring. So let's see, do we have open coil spring here? No, this picture doesn't show. Basically, there's a spring. We use a little spring here. The spring, you compress the spring. So when you insert the spring pushes to open the space. So after we create enough room for those 2 upper canines, the canines are brought in via a thin, small dimensioned nine-tie arch wire. So we have a large base arch wire connecting all the teeth and a small nine-tie wire to bring the 2 teeth down. And then this is a progress photo where the canine has dropped in. However, he's still class 2, meaning that his teeth are positioned a little bit more forward. Upper teeth are positioned a little bit more forward compared to his lower teeth. So we used an appliance called forces. This is a little spring that connects upper teeth to lower teeth. Basically, it will help push lower teeth forward and mostly lower teeth forward, and harness the patient's mandible growth potential or lower jaw growth potential since he's a teenager still growing. And this picture shows after the forces appliance, a little spring, after that was removed, his class 1 over here and class 1 over here. So now we basically just need to do some detailing. So orthodontic treatment has 3 stages most of the time. One is align and level, basically making all the teeth straight. Second is working stage. Working stage is you do the bulk of the work, such as correcting class 2 or class 3, closing all the space. And then last stage is detailing and finishing. Basically, you do your wire bands or repositioning bracket to make sure all the teeth fits nicely, upper and lower teeth in false to falsi relationship. This is his finish. Next case, this is a surgical case. She has underbite. And as shown in this picture, it's not just a teeth. Her lower jaw is positioned more forward than compared to her upper jaw. In addition to that, she has congenitally missing 2 upper lateral incisors. So upper central incisors and canine. So 2 teeth are missing here. We put braces on, leveled and aligned. And for surgical cases, the case will look worse before it looks better. So as we prepare for her for the surgery, her underbite actually got bigger, which is good. This is our goal. We call this decompensation. And this is her photo right before the surgery. This is called the surgical hook. Basically, after the surgery, in the old days, people after jaw surgery, people has a wire shut. There will be the jaws are wire shut. Nowadays, we don't have to do that anymore. The patient will just wear rubber bands. So the hook, the surgical hook right here, you see, along with some other hooks that came with a bracket, those are for rubber bands. For patients to use after surgery to maintain their jaw-teeth relationship and help maintain the jaw relationship. This is her right after the surgery. The underbite is gone. They did 2 jaw surgery. Basically, her upper jaw got moved forward. Her lower jaw got moved back. In addition to that, they also did some vertical correction too. The first thing when she came back from surgery is that I like my nose so much more, which is interesting because we did jaw surgery. I was there during the surgery. Basically, what the surgeon did was they gave her almost like rhinoplasty. They cinched her nose a little bit, so her nose when you bring the maxilla or the upper jaw forward, your nose will the patient nose will look a little wider, which is in general will make the patient look slightly older. So what the surgeon did really quickly, that was done within like a few minutes. He moved the nasal septum and basically the middle part of the nose and did some suturing. I'm not sure what exactly he did, but her nose is straighter and narrower, which she really liked. And the teeth relationship and jaw relationship got corrected. And this is her finish. And if you look at the profile here, she started with an underbite. The surgery really make a big difference on the patient profile. This is after surgery. This is the post, still with some swelling. You see her cheeks are a little puffed. And then this is her final. So her profile is improved a lot. And that's the end of my presentation. Thank you so much for listening. And now I will take some questions.
Thank you, Dr. Dong. So I'm just gonna, if people have questions, you guys can either put in the chat or go ahead and ask Dr. Dong herself. But I'll be reading them off as they come if they are in the chat.
Sounds good. And thank you so much for the congratulations, guys. When did I decide to go into orthodontics? Great question. So I didn't know I wanted to do dentistry when I was in high school or while I was in community college first 2 years. I only learned about dentistry when I listened to a guest speaker out of all the classes in my physics classes. I knew I wanted to do healthcare. So I listened to the guest speaker who talked about UC San Diego Pre-Dental Society. I went there to shadow and really loved how the dentistry is really a blend of art and science. So I saw how they make a composite, how they make the crown. I really loved it. So that's how, and then that's how I decided to transfer to UC San Diego and do dentistry. And in dental school, my original thought was to do general because I really love general dentistry. I went into UCLA thinking I will come out becoming a general dentist, but while there, I get to explore different specialties and just really fell in love with ortho. I still love general dentistry, but I really love ortho as well. So I decided ortho residency in dental school. And I wasn't sure if I liked orthodontics enough even when I decided to apply for ortho residency, so I did, but I still applied because if I was gonna specialize, this is my number one choice, and got into a great program. By the way, ortho program is a match process. So unlike dental school, you get into, like, you apply for 20 programs and get into 10. For ortho, you get matched into one program. So you have your rank list of different programs. The program ranks you, and it's a matching process. You don't get into multiple, you get into one. So yeah, I decided on ortho in dental school. Long story short, did you take any gap years? Yes, I did. I took a gap year between dental school and no, between college and dental school, because I could have applied when I was a third year in college. However, I didn't think I would get into a program of my choice. I didn't think my resume was strong enough at that point. So I decided to take a gap year, and I worked as a dental assistant at a dental office for about 8 months, which is really beneficial and highly recommended because you do see a different side of dentistry. As a doctor right now, I work with many assistants, and I really feel like my experience working as assistant helped me understand their perspective better. So, and in addition to that, you learn many things in dentistry while working as an assistant. So highly recommend. Yes, that's the only gap year I took. Would you recommend becoming a dental assistant during your undergrad years? Yes, definitely. Even not working, shadowing definitely helps too. You learn different procedure, you learn different materials, but most importantly, unlike dental school, you learn this in dental school anyways. I think what I learned the most is customer service and how the office was run, how the communication works between the front office and back office. So those soft skills, or those skills you see in private practice, it's hard to learn in dental school. So yes, highly recommend shadowing or working in a dental office while you're in your undergrad. What advice do you have for anyone who is currently a second year in college? Is there anything that you recommend we do? Yes. First is keep your grade decent, and then join some organizations, clubs, whatever you like. It doesn't have to be dental or orthodontics related. I think whatever you like, and be committed to it, and be involved, be engaged, and take a leadership role helps a lot. I think it's like the skills you learn and the leadership position or responsibility you take on is more important than what you actually, the area you do, like not just dental, And so other than that, leadership, community service, volunteer to community service helps. And teaching, I worked as tutors while in college, which helps to teach, it helps to teach people things because sometimes you think you said something in a certain way and it's clear, but it's not clear to other people. So I think it's helped with communication, and I do enjoy teaching and mentoring too. So I enjoyed that. That's something I did also. Basically, whatever you do, keep yourself busy.
One of the questions was, for the third case, did you say the point jaw was
Patient
positioned
jaw,
more
Oh,
congenitally, or
yeah, the patient had underbite. So this is her upper teeth, this is her lower teeth. The lower teeth are positioned more forward compared to the upper teeth. So not only she has her lower jaw is positioned more forward to her upper jaw, not only that, she's missing 2 upper teeth, which makes the situation worse. So sorry, if I stated her upper jaw was more forward, that was a mistake. Her lower jaw was forward. So she had an underbite. Was that congenitally? So yes, class 3 or underbite situation is a genetic condition too. In her case though, I don't think it's genetic because when I interview the patient, no one else in her family has that problem. So in her case, it can be genetic. Maybe it's just not expressed in her family, but it can be genetic. In her case, I don't think it's genetic. Yes.
The question was, how did you manage the rigors of dental school and residency plus maintain work-life balance?
Okay. The answer is I don't think I have a work-life balance. I work too much. Yeah, but that's my choice and I enjoy it. And I'm married. I dated him for 5 years before getting married, and he works a lot also, so it works out for our relationship. So I work a lot, he works a lot, and we have time together. We plan our date night and we go out, we plan trips way ahead of time. I think time management and prioritization are very important. In addition to that, how do you want your life to be, or what do you want in life? If work-life balance is something you want to, I wouldn't do as much as I do for work or for my career. But what I do drives me, and I enjoy doing that. So I work a lot, and sometimes I don't get enough sleep. Sometimes I miss gym days. I don't go on a lot of trips. I go on a lot of conferences, but not international trips. But that's okay with me. So that's a long answer for your short question. Basically, what do you want? Search yourself, and what kind of life do you want? And go from there.
Another question was, how long did it take you to become a dental assistant? Where did you go to earn it? And yeah.
I think becoming a dental assistant is easy. A lot of practice will just hire you without any experience. What you may asking is a registered dental assistant, RDA. To become a registered dental assistant, you get paid slightly more, and you have to get your X-ray certificate, many other certificate, have to do shadowing hours, many other things. So I wasn't an RDA, but I did have my X-ray license in a local school in San Diego that offers X-ray license to dental assistants. So I just got my X-ray license and I learned everything on the job. And many offices have staff shortage right now. I'm sure they were happy to take anyone without experience. And to me, as a future employer at my own practice, I would actually prefer someone without experience, so I can train them my way and do things the right way. Versus, yeah.
Another question was, when did you decide you wanted to own a private practice?
I always knew. I always knew I want to be my own boss. Even before dental school, I wanted to have my own thing. In dental school, I thought I'll be a practice owner for general dental practice. And in ortho, I knew I wanted to own an ortho practice. The question is not whether to own or not. It's do I want to buy an existing practice or start my own practice? So I just always knew I wanted to be a business owner and wanted to be my own boss and create my own thing. So that's a calling that I always had.
Uh, as more questions keep on coming, I also had a question. So there's obviously a lot of like new clear aligner therapy, like equipment out there, and there's some that are with attachments and without attachments. How do you know like to diagnose patients with attachment clear aligner therapy or non-attachment ones?
Okay, yeah, that's a tough question to answer. And the person who asked this question, oh, is that your question?
That was my question. Yeah.
That was my question. Okay, you knew a lot of ortho already. Great job. So that's two different philosophy. I think orthodontic nowadays are having two. I see many. I see many topics. There are people with different philosophies. So there's a school of thought that yes, you can move teeth without attachment because the plastic basically wraps around the teeth so well, and you can move the teeth. However, a lot of people think as with braces, you need a bracket on the hand, basically a door handle on the tooth so that you can move the tooth better. I think what you decide to do is your own choice. And for the longest time, attachment is a way to go, but many people, especially recently, has been advocating for aligners without attachment. I have not tried aligner without attachment on complex cases. Yes, I have tried on simple cases, but not on complex cases. So if I were to treat patients with aligners, yes, I'll most likely use attachments. But I will keep taking continuing education is big, so I'll be keep taking courses to learn more about it, especially aligner without attachment, because as a patient, I would like that better, obviously.
Thank you.
You're welcome. I have some direct messages. Do you think it's still possible to get into dental school with little experience? Yes, I think it's possible. You should give it a try. I plan to get more experience after I graduate because I'm taking a gap year. Yes, that's what I did as well. I could probably still got in or not get in. I wouldn't know because I didn't try. In my third year, I tried to, I wanted to apply for dental school, but I didn't think I was ready. So I decided to take a gap year and got into UCLA, which I'm happy about. So if a timeline is on top of your priority, I say give it a try. If not, taking gap year helps too. Another direct message. I have been working as a dental assistant since last May, and I recently switched to pre-dentistry, so I don't really have a lot of knowledge about this field. Okay, I think it's probably related to the last question. How long did it take you to become a dental assistant? Oh, okay, we already answered that. Any other questions? Do you think grades, DAT score, or extracurriculars are more important? I think they're all important, and depending on the school you're applying for, they're gonna want different things. There are school personalities. So orthodontic program have personalities. They like certain candidates better than another in some schools. Grades, I think keep it decent. DAT score, same thing. With both things, the higher the better, but I don't think it's a own determination for whether you get into dental school or not. They look at your resume, and if your DAT score and your grades are good enough, you get an interview. What you do at the interview is what decides. So DAT score and GPA get you into interview, and your performance at interview get you into dental school or ortho residency. Extracurriculars, I think it's pretty important to whatever you want to do, whether that's an interest you like instrument or sports or organizations or community service. When do you think is the best time to take the DAT? You have to take it before you apply. I took it during my gap year, and I think it worked out great. Basically, when you have time, and with dental school application, I think it's a rolling basis. If I remember correctly, it has been a while. So the earlier you turn your application, the better chance you have getting into the school. So definitely make sure you have your DAT ready to go before application opens.
Another question was, how did you improve your hand skill in dental school?
Practice makes perfect, but I do say some people have some advantage over others. Hand-eye coordination is different people start at different level. Some people are natural, some people are not, but everyone can do good dentistry with practice. And I have plenty of classmates staying after hours and on weekends to improve their hand skills. And they do great dentistry. So practice makes perfect.
Another question was, do you have any advice for students trying to shadow as an orthodontist yourself? How do you think we should ask?
I think you should just ask. Student ask us, our patients ask us. Literally had two patients wanting to shadow me. So patients ask, a dental student ask. I think just ask. People most likely will just say yes, come over. And the orthodontics shadow each other. So I will probably be going to visit some orthodontic offices myself to learn from them, and I'm happy other orthodontic visit me too. So if you want to shadow and you're local, feel free to come over to my office. I think most dentist or orthodontist wouldn't mind for you to just hang out and shadow.
The question was, as far as your personal statement, are you willing to share what experiences inspired you when structuring your personal statement?
I think it is highly personal, not just my personal statement. It's highly personal statement. It's personal statement, personal for a reason. Like different people have different stories. I think tell your story. Where are you coming from? Why dentistry? Why you? Why this program? Or why this dental school? So same for personal statement and for your interview. Three main things to consider. Why you, not others? Why this school, not others? And why dentistry? And I would just tell my story. And keep in mind, your personal statement is not a rewrite of your resume. So I wouldn't list all my qualifications and experience on the personal statement. It's more like a storytelling rather than bullet points listing of all your accomplishment or involvement. Tell a good story and stay true to yourself will be my biggest advice. Yeah.
Another question was, what is it like getting a loan from the bank for your private practice? Do you need a certain amount or range of savings slash cash flow, considering that most of the dental students are on debt, like dental school debt?
Yes, very good question. Most dental students and orthodontic residents, especially ortho residents, since tuition is very highly expensive, have debts, which is not a problem. They understand dentists and orthodontic coming out of school has huge debt, and that's not a concern to them because dentistry and orthodontic practices are good business. The default rate, I think, is below 0.1% or something. So they're not concerned you not succeeding or not paying off your debt. However, one requirement they will have for your loan to be approved is to have some liquidity, meaning you have money you are able to move around, including your the money you have in your checking account, your stock options, and some other account. I don't remember. There's three big categories, but you need to prove them. You have some money on hand. So if you have if this starting a practice or buying a practice is what you want to do, and between paying off your debt versus saving some money in the bank, I would try to save some money. So you have some money on hand to show the bank, hey, I have some money, so give me some more loan, versus using all your income to pay off your debt. And other than having some money in your bank account, not depending on the loan amount, I think it's usually 5 to 10% of the amount you're trying to take out. If I remember that correctly, I did that a long time ago. So 5 to 10% of the saving, 10% of the loan amount to have in your savings account. And other than that, have good credit history, use your credit cards and pay off your credit card debts. So have a good credit score. And don't make big purchases like nice cars or a nice big house, things like that. You should be fine if bank usually don't give us a hard time on that.
And the question we had was, did you have any experiences coming into dental school in regards to manual dexterity, such as art, cooking, etc.?
I think doing my makeup helps. Seriously. You know, when you do your eyeliners, your brow, you have to be very precise. So other than that, I like arts and crafts. So growing up, I did a lot of art projects, which helped me with my hand dexterity. So I actually didn't think labs in dental school wasn't that challenging. I say whatever you enjoy doing with your hands, definitely just do them. Hand-eye coordination, the hand dexterity, and more importantly than hands, because I feel like you can practice your hands, your eye for details. Like, can you see what's not there, and can you see what can be improved? It's like your eye for detail. That's very important as well. If you don't see it, you can't do it with your hand. You first have to see it and diagnose it, and then perfect it with your hand. So yeah, the eye for detail and practice with your hands. But I do think doing my makeup helps a lot.
Well, thank you, Dr. Dong. It seems like these are all the questions that we did have for today. Thank you so much for your time. Your presentation was amazing and very informative for us. Viewers, thank you for tuning in today. The attendance quiz will be found in our Instagram page, the YouTube live stream, or group chat, group me chat. And the quiz will be open for the next 12 hours. Okay, so thank you again, everyone, and hopefully we see you in the next session. Thank you, Dr. Dong, again.
Yeah, you're very welcome. Thank you everyone for tuning in. It's really nice meeting you guys. Great questions too.
Thank you.
Okay, bye.
Bye.